Good morning to all. Today's discussion will be on benzoic acid. Industrially, if you see, benzoic acid is used in the production of dyes, especially aniline blue. You have something called as sodium benzoate, which is used as preservative. It is also an ingredient of mouthwash or face wash. So you can see the structure of benzoic acid is nothing but benzene with carboxylic acid group. The important compound that is coming from benzoic acid is aniline blue, which is a dye. Again, from an APGT point of view or a competitive exam point of view, the important thing to be remembered is aniline blue is associated with bladder cancer. I think also skin cancer is also associated from there. Now, this comes as an occupational hazard. So that is why when you see occupational diseases like your pneumoconiosis or your occupational cancers, this will again come as an important question. Now, aniline blue, from a microbiology point of view or a histological staining technique, it is used or it is an ingredient in Mason's trichome stain. Now, in this trichome stain, you also have other examples, but basically in Mason's, it is used to differentiate connective tissue from a muscle, especially collagen. So, collagen is stained as blue. So, this differentiates collagen from muscle. Okay, so collagen is blue and muscle is red. Also, aniline along with eosin can be used to stain sperm DNA especially, so to understand the sperm maturity, whether any defects are there. So there is something called as fragmentation index that is actually investigated in case of male infertility. Usually higher fragmentation index is related to more possible infertility chances. Okay, so that's all about industrial uses or other applied uses of benzoic acid. Common name is same benzoic acid. Whole method is 6A. So you need to remember two exceptions from the acid. We already know the thermal exception. Generally, acids are thermally chilly, whereas picric and fluoric acid is hot. Now, coming from a pharmacy part of, you need to remember benzoic acid as well as carbolic acid. Usually stays away from the usual role. Okay, acids are usually coming in class 5 preparation of old method, whereas benzoic and carbolic acid belongs to 6A. New method is having a drug strength of 1/10. Constitution, we know it is indicated medicine for gout, all the rheumatic complaints that arise from gout. So yeah, there is a psychosyphilitic background running in the patient. In children, you have diarrhea running through the diaper. Okay, the diarrhea of children, white, offensive, exhausting, liquid stools running right through the diaper. So that is the important symptom. It usually comes. I don't know. I feel like benzoic acid is one of the favorite of examiners these days. And it also have a comparison with podophyllum. Again, it also have other ailment factors in podophyllum, like teething. It also can happen as a modality. If you think after eating, it can happen, the diarrhea can happen, or even washing or bathing can cause diarrhea. That being said, urine, the main important symptom of benzoic acid is that the intensified urinous odor, and it is a part of trio of offensive urine. So trio of offensive urine have obviously three people. One is nitric acid, sepia and benzoic acid. Nitric acid, the smell is described as that of a horse urine. Horse urine smell is seen in nitric acid. In sepia, it is so offensive that the urine sample or the container that has urine has to be kept away from the room. It has to be removed from the room. Okay, that is the level of order it is mentioned. And in benzoic acid, the highly intensified urinous odor, that is the definition given or the description given. It also is described as a repulsive odor in boric. Urine is offensive, dark brown. It also has a deep red color. So both descriptions are there. In children, you have nocturnal enuresis. Now, what is nocturnal enuresis? By definition, children who have difficulty in controlling urine, especially at night, above the age of 4 years. Usually in practice, you can see 2 to 3 years, by the age of 2 to 3 years, children usually tend to gain bladder control. But sometimes, up to 4 years, it is considered as normal, and after 4 years, it's definitely considered as abnormal. Alright. Now, in old men, you have something called as benign prostatic hypertrophy, BPH, which causes dribbling of urine, and there is strong characteristic odor and excess of uric acid. Again, it can cause catarrh of bladder after a suppressed gonorrhea. So, we already said gonorrhea or a syphilitic background is running in the patient, and from which complaints can arise. Okay. Cough, again this was a question I guess in one of the APGT. Cough with expectoration of green mucus, again natrum sulf is mentioned in the brackets, extreme weariness and lassitude. Okay. So we don't actually see much prescriptions of benzoic acid in cases of cough. But when I was reading the industrial application of benzoic acid, it is actually used for disinfection, especially all your inhalers. There benzoic acid is used. So it also has some kind of action in the respiratory tract. Okay. So cough with expectoration of a greenish mucus is having natrum sulf, and you have benzoic acid. You also have comparison with pulsatilla, calibic and all. But again the characters are a little more different there. Again pulsatilla is bland. You have changeable character. Calibic, you have that clinkers, that stringy discharges. In extremities, you have gouty concretions, arthritis vaga, affects all the joint, especially the knee. So, it is kind of a characteristic symptom because gout usually affects small joints, whereas knee joint is a pretty large joint. Okay, and pain, tearing, stitching in large joints of big toe. Okay, so here that is a classical sign of gout that is known as podagra. There is swelling and pain of the MTP, the metatarsophalangeal joint. So that is where all the inflammation occurs, and there is redness and swelling of the joints. Gout is aggravated at the night time. So these are some characters of benzoic acid in gout. Okay, so it affects basically the knee joint, cracking on motion. There are nodosities. Okay, then there are night aggravation that is seen, and the pain is described as tearing or stitching. You also can see podagra in this patient. From boric, there needs two, three points to be discussed. One is child want to be nursed in arms will not be laid down. Okay, so that carrying desire can be taught in these people. Child wants to be nursed in the arms. Okay, and pain suddenly change their locality. So again, one of the changeability is seen. The diarrhea can be described as soap suds. Okay, soap suds, basically the bubbles of soap. You have repulsive odor of urine, asthmatic cough, worse at night, lying on right side. Another important question. asthmatic of worse at night, that is fine, lying on right side aggravation. Okay. And bunion of grade 2. Now bunion is again some bony growth of the MTP. Okay, the metatarsophalangeal joint has a bony growth that again causes, that can be associated with hallux valgus. Okay, medial deviation of the grade 2. Comparison, we already did the trio, and we have an extra person here just to, since there is host urine, we would also like to know what is the remedy that has urine smells like cat's urine, that is cajuputum and viola tricolor. Okay, cajuputum and viola tricolor has urine smells like cat's urine. In enuresis, you have enuresis in old people in this remedy, Sickle core. Diurnal enuresis. So diurnal means should be morning as well as in the night. So that is ferrophos. And along with worms, some children might experience nocturnal enuresis, and that remedy is silica. Okay, so 3 things that you need to remember: nitric acid, horse urine, sepia so offensive that should be removed from the room, cajuputum and viola tricolor has cat's urine like smell. In enuresis, old people usually comes with enuresis. You can think of Sickle core along with all your arteriosclerosis, all those things. Okay. Ferrophos, you have diurnal enuresis. In silica, then you have nocturnal enuresis in children with worms. In gout, again, colchicum, formica rufa, lithium car, and artica urins are indicated remedies. The modalities are mentioned. I am not going in detail. Here the basic things you need to remember is colchicum. Touch aggravation is marked. Okay, so touch, evening, night, and warm weather. Something that you need to remember is arthritis in warm weather is little characteristic. So usually arthritis or all the bone pains are aggravated in the winter time, but colchicum has warm weather aggravation. Warm weather aggravation with evening, night aggravation touch. So those are common symptoms. In formica rufa, right side affinity is marked. Okay, so right side is mostly affected. There is acute episodes of gout. Not better by sweating, and there is better by rubbing. Better by rubbing as well as better after midnight. So again, that are characteristic symptoms. After midnight amelioration as well as amelioration on rubbing. Okay, that is formica rufa. Lithium car, almost like a non-specific things, but there is better by hot water. The pain of toes is better by hot water. All other symptoms are there, and a general modality given is better by moving about. But I don't know whether it can be applied in your specific complaint like gout. There is a general modality given as better by moving about. Urtica urens, main important thing is deltoid rheumatism. Okay, and that alternates with urticaria. So rheumatism alternates with urticaria, aggravation touch, and cool moisture. Okay. So the modalities of benzoic acid is aggravation in open air and by uncovering. Okay, aggravation in open air and uncovering. In relationship, it is antidoted by copaiba, but it is useful after copaiba in gonorrhea. So in gonorrhea, you can give copaiba followed by benzoic acid. You can use benzoic acid after colchicum fails in gout. Okay, and wine aggravates the complaints of benzoic acid, something that you need to remember. In wine, you have cincum, conium as well as alumina along with your wine aggravation list. Questions to be discussed: enuresis diurna et nocturna. Okay, so both are there. Profuse watery urine, where habit is the only ascertainable cause. It is a straightforward answer. Question. The answer is acquisitor. Okay, option A. Uric acid diathesis, swelling, tenderness, better hot water. So that should be lithium carbon. Okay.